Hi and welcome back to another video of Medic Notes. This video will be on artificial rupture of membrane. Indication to do this procedure is to induce or augment the labor process. And this is a picture showing how we insert the amnio hook, hooking the amniotic sac. The effects of this procedure is when we break or rupture the amniotic sac, it will cause an increase in production of the hormone prostaglandin. And when this prostaglandin increases, it will speed up the uterine contractions. So it can fasten the labor process to avoid prolonged labor. So for the procedure, before starting the procedure, the patient should be in relaxed position in the recumbent position with feet together and hips externally rotated, like frog-legged position. Before, during, and after the procedure, record the fetal heart rate to make sure there is no fetal distress or other problems. Perform a cervical examination to confirm that the membranes are still intact, cervix is at least 3 cm dilated, and the head is well applied. Also exclude the presence of an umbilical cord. So after being prepared for the procedure, we introduce the second and third digits of the non-dominant hand, palmar side up, into the vagina. So if you are a right-handed person, you use the second and third digit of your left hand, insert into the vagina, and insert the two fingertips past the cervical lip into the uterus and against the amniotic membrane. Make sure that the fingers are placed against the membrane instead of the cervical lip. Next, we use our dominant hand, which is the right hand, to take the amnio hook. So this is a picture showing how we insert the hook. So introduce the tip of the hook into the vagina and into a position between the two fingers we have inserted just now. Because there is a sharp end at the hook, we don't want to lacerate other structures. So insert it between the two fingers. And slowly introduce it into the vagina until it reaches the membrane. So take note that the amnio hook is pointed downwards, away from the membranes first. Then when reaching the membrane, we will turn the hook upward, which is rotating 180 degrees, so the hook will be pointing upward. Then apply the pressure to the amniotic bag with the hook and rupture it. So if it is successful, we will see amniotic fluid flowing out from the vagina. If there is no fluid seen, then we have to repeat the steps around 2 to 3 times until we see the amniotic fluid flowing out, which will confirm the rupture of the amniotic membrane. After the procedure is successful, we remove the hook slowly. Maintain the fingers of the non-dominant hand, in this case with the left hand. Maintain the fingers against the fetal head as the amniotic fluid is flowing out. So we take note of the color of the fluid, whether it is clear or meconium stain. And also make sure that there is no cord prolapse, because this will cause fetal distress later on. Then remove the finger slowly and start observing the fetal monitor for any non-reassuring signs on the CTG, such as fetal bradycardia or tachycardia. So prepare to respond if there is an abnormal fetal heart rate. The advantages of this procedure is we will be able to shorten the labor, maybe shortened by an hour, and we can collect the amniotic fluid for examination, such as if there is presence of meconium stained fluid, then we may indicate fetal distress. And we can also monitor the fetal heart rate with the CTG directly on the fetal scalp. Some disadvantages are the baby may turn into a breech presentation, making the birth more difficult if the membranes are ruptured prematurely before the engagement of the head. And there is also an increased risk of umbilical cord prolapse and increased risk of infection, especially if there is a prolonged duration between the rupture of the membrane and the birth of the baby. That is all for this video. Thank you.